That sounds great. Okay. Rhonda, you're up. And I'm taller than you, so we'll pull you down a little bit.
Thank you so much. Good morning, everyone. Thank you so much for coming. My name is Rhonda Mayfield, and I have the best job on the planet of being able to be the CNO, Chief Nursing Officer, for OakBend Medical System. My mentor and CEO, Mr. Joe Freudenberger, is incredibly disappointed that he's not able to be here today for this wonderful milestone. He had a family emergency that he had to tend to, but he's definitely here in spirit with us. So you're all stuck with me this morning. But welcome. We're so grateful that you're here to celebrate with us. So on behalf of Joe and the OakBend family, I cannot express the gratitude and thankfulness to the innovative minds that have fostered this partnership. Paul and I were just discussing a few moments before the event began about how this partnership makes sense because of the relationships that already exist due to the aligned missions and purpose of OakBend, Ibn Sina, and Sam Houston, which is to provide excellent care, mostly for the vulnerable population. So I'm excited to see this program flourish so that we can take even better care of our community. Thank you so much. And now I have the honor of presenting our Master of Ceremonies, Dr. Paul Umbach.
Thank you very much, Rhonda. It's my honor and privilege to be here today to officiate sort of as a minister a marriage between multiple parties here in Fort Bend County. Today we have a historic announcement of medical education growing in this region. And as you all know, as this community continues to grow, there needs to be more physicians and more healthcare providers. And it takes a partnership to do that. So my role today is to read to you the announcement, and then each of the parties from Ibn Sina, from Sam Houston State University, and from OakBend Medical Center will say a few words, and then we're also going to be having words by County Judge K.P. George and Commissioner Dexter McCoy. The county is an important part of this partnership because they have been so helpful in bringing everybody together. And I want to thank everybody here today. I also want to recognize my teammate, Ha Pham, who has been working for 2 years with Mr. Rapani and the parties here to pull this together. So what do we have today? Well, we have a partnership between the Ibn Sina Foundation, OakBend Medical Center, and Sam Houston State University College of Osteopathic Medicine. And they're announcing a clinical partnership to train medical students and residents right here at OakBend Medical Center and at the extensive Ibn Sina Clinic system. Over the next few years, there will be medical school students starting just this year in August. They'll be here spending their entire fourth year and third year training in this facility and other facilities within the OakBend system. They'll also be training at the Ibn Sina clinics. The big news comes in 2 years when a residency program for family medicine can start. And then as this grows over time and more students are trained here, we see a clinical training region emerge where students and residents will be in all the neighboring counties throughout the Texas Gulf Coast region. And as you might know, a lot of the residents and students in Houston are concentrated at the Houston Medical Center. But we need to have physicians everywhere. And data shows that if you go to medical school and train in a hospital like this, and then do your residency in a hospital like this or other hospitals within the system, you have a very high chance of staying in that community. And you even have a higher percent chance if you're from that community. So I'm going to start today by introducing each of the principles. Let me begin by saying I've always said that there are 3 words that start with P. People in a place with a purpose. And for about 35 years, I used that, and I said that's when the magic happens. People, place, and purpose. But for 2 years, my friend, Mr. Rapani, has taught me about a fourth P word, and that is passion. And the driving force behind this program is Mr. Rapani's passion. And this is the only one of the medical education programs I've been involved with that started with the vision of a community health center. Most partnerships like this come out of a university, they come out of a medical center. And so without further ado, I want to introduce my friend, founder and chairman, Ibn Sina Foundation, Mr. Nasruddin Rapani. There you go.
I think it might. Bismillahirrahmanirrahim. County Judge K.B. George, all the elected officials, distinguished guests, healthcare and education leadership, community leaders, ladies and gentlemen, very good morning. I am Nasruddin Rapani, founder of Ibn Sina Foundation. Today marks a historic moment as we celebrate the formal partnership of a clinical training region between the Ibn Sina Foundation, same Houston University and College of Osteopathic Medicine, and OakBend Medical Center. This partnership is a beacon of hope, knowledge, and joy, as it aims to prepare physicians to serve the underserved population in Fort Bend County and the greater Gulf Coast region of Texas. Our dedication to bridging this gap remains steadfast in a world where accessibility, quality, and healthcare remains a pressing need. Over 2 decades, Ibn Sina Foundation has been serving tirelessly when providing healthcare to over 1.5 million patients visits underserved population. Now, we must progress forward in training healthcare professionals to extend upon our outstanding commitment. The vision of this partnership unites us today: equity, justice, and healing. We acknowledge that the health disparities are not mere statistics, but manifestation of human suffering, untapped potentials, and the absence of hope. Fort Bend County, renowned for its diversity, resilience, and spirit of unity, warmly embraces this partnership, which will define the landscape of medical education. Through this partnership, our students will have the knowledge and skills to confront healthcare disparities head-on. Through immersed experience, mentorship, and community partnership, our students will gain first-hand insight into the social determinants of health that perpetuate disparities. Our commitment to serve the underserved extends beyond the classroom to the community. We will continue to address the needs of those in underserved neighborhoods, providing them comprehensive healthcare services to those who are in need. As we embark on this journey, I implore policymakers, healthcare organizations, and philanthropic leaders to join us. Together, we can reshape the healthcare landscape in Fort Bend County and beyond, empowering communities and ensuring no individual is left behind. In conclusion, I sincerely thank Dr. Tom Moore, Dr. Mike Stevenson, and Joe, and those who are gathered here today to embark this journey with us. Finally, I wish to thank Fort Bend County leader, Judge K.P. George, and our Commissioner, Dexter McCoy, who has been strong partners of Ibn Sina Foundation and are actively engaged in this transformational partnership. Your unwavering commitment has made this day possible, and I am confident that together we can make it happen. God bless America. Thank you.
Excellent job. Excellent job. Thank you, Chairman Rapani. It's a beautiful day outside, and I want you to know that partnerships take a variety of people. I always say that to do a program like this, you need 1 million friends. And as we were looking to develop this program, we needed a medical school and one that matches the same vision. And a medical school that's new and innovative, but also serves the people. And I had a friend, Dr. Tom Moore, who is at a medical school in Boise, Idaho, and we had worked together and become friends. And I was able to call him when Joe Frudenberger told me that if you want to work with us, you got to call Tom. And I go, well, I know Tom, I'll call him. And today I want to invite up the Dean of the Osteopathic Medical School and also the Provost, Dr. Mike Stevenson, and also Dr. Tom Moore. They're going to come up together and say some things about the medical school in Conroe. So if you jumped over Houston from here, you'd end up in Conroe. And then if you went up the road a piece, you'd be in Huntsville. So I'm going to introduce Dr. Mike Stevenson and Dr. Tom Moore. Come on up. Together.
Good morning, everyone. It is an honor to see so many of you here today on this very, very, very outstanding occasion. Thank you for the opportunity to be here. Chairman Rapani, thank you for your vision. Sam Houston State University has a mission that I would like to share with you. It's a student-centered, community-engaged institution whose mission is to offer accessible, quality higher education. The university offers a variety of innovative and flexible degree programs at the undergraduate, graduate, and professional levels focused on career readiness, personal and professional development, and service. SHSU provides integrated academic and student success services designed to support traditional and non-traditional students from diverse backgrounds. Our mission is consistent with why we are here today. It is an honor and a pleasure to be here, and thank you for coming. There are two other P words you should know about. A provost is pretty quick. So I'm going to stop and turn it over to Dean Moore to talk about the College of Osteopathic Medicine.
I'm going to remind him of that when he does my annual review. Thank you, Dr. Stevenson. Thank you, Paul. It is such a pleasure to be here. As said, my name is Tom Moore. I'm an osteopathic internal medicine physician, a primary care physician myself, and I'm so pleased to be able to serve as the Dean of Sam Houston State University College of Osteopathic Medicine. Dr. Stevenson shared our mission. I'd like to share our motto. And if you come to our main campus in Huntsville, you'll see emblazoned on the wall, "A measure of a life is its service." And I think that that's something that defines not just our university, but this partnership, service to other people. How can we help people? And I think that that's why so many of us have gotten involved in healthcare from day one. And that's part of the reason why this 130-year-old university in Huntsville decided just about 5 or 6 years ago, we think that we need a medical school. And we want a medical school that's a little bit different. The Texas Medical Center is premier. It's one of the best in the world. But it hasn't changed the fact that we have whole swaths of individuals that don't have access to primary care medicine. We have rural areas that don't have any doctors. We have urban areas where you can't get in to see a physician. And in those healthcare deserts, we lack an infrastructure for the continued growth of our state and our region. And we hope to do something about that. And so Sam Houston State University created their 8th college, the College of Osteopathic Medicine, and we're now in our 4th year of operation. This is an exciting time. In fact, this is an exciting week for us. This is the week of Match, which is where our graduating students find out where they're going to go to finish their residency program. We'll find out on Friday, and we're very excited about that. So medical school is an interesting thing. After your bachelor's degree or master's degree, you start medical school, which is a 4-year curriculum. The first 2 years are done in our classrooms on our campus in Conroe. And while our mothership is in Huntsville, our medical school is in Conroe. And those 2 years, they learn all of the details of what it takes to be a physician, not just the knowledge to be a physician, but how to relate to people, how to meet them where they are, how to partner with our patients so that we get patient-centered care, not disease-centered care. And that's something that's really important. And so after those first 2 years, we then start into our clinical rotations. We don't have a Texas Medical Center at Sam Houston State University because that's not the way that we think. If we want our students to practice medicine in those rural areas and those community-based hospitals like OakBend in urban areas, we need to train them there. And so during those 3rd and 4th year of their training, they actually move to a clinical region. We currently have a few of our students right here already in OakBend and some rotating in the clinics at Ibn Sina. But our hope is that with the vision of Mr. Rupani and the leadership of Joe and the OakBend team, that we can continue to grow that even more. And so they will move here to Fort Bend County and be able to spend their 3rd and 4th year doing their training at this hospital and in clinics in the area. And then they'll graduate, and they'll have to do at least 3 to 5 years of residency training. And we're actively working to promote the development of new residency programs. And part of this partnership is that over the next couple of years, we'll be able to create primary care residency programs where they'll then stay here and become embedded in the community for the next 3 years. And the studies show that folks tend to settle down and practice within 50 to 100 miles of where they finish their residency programs. And so ultimately, as we all come together to try to serve the community, our hope is to increase access to care, increase primary care, increase community-based, patient-centered care. And we do that best, not at a large academic medical center, but right here at OakBend Hospital. And in our Ibn Sina clinics, where you can actually train with patients that are in need, and you can get to understand their culture, get to understand what it is that makes them tick, and how you can partner with our patients for their own health care that improves their lives and it improves the lives of the community. We are so excited to be a part of this project and being able to work along with Ibn Sina and OakBend to be able to create a clinical region here where we can continue to grow medical education and hopefully, as time goes on, move the needle on access to care. So thank you all who've been a part of this. Again, thank you, Mr. Rupani. This is a blessing, and we're looking forward to our continued work with all of you. Thank you so much.
It's really important to have friends, and over the years, connecting friends is very important. Mr. Rupani has a lot of friends. A lot of friends are here, and I want to thank you for coming. He also has a friend, several friends, at the county, at Fort Bend County. And one of his good friends, I'm going to ask to come up, and you all know this person, County Judge KP George, and he has been a friend from the very beginning. So, KP, the floor is yours.
Good morning, everyone. It is, I don't know how to express my gratitude. It is absolutely a wonderful day in Fort Bend County. And first of all, I want to start with Chairman Rupani, because as an immigrant myself, there is a lot of immigrants. We are the most ethnically diverse county in the country. As an immigrant, I know our community, how they behave. Many times we come from other side of the world and come and make money and, mind our business. That's what we do. And when I saw the second I get to know about Mr. Rupani, he is an exception to that rule. And he said, you know what, this is where I become successful. And this is where I'm going to make this community a better place. And started with that foundation. And last year I heard he saw almost 100,000 appointments plus, right? And that is not rich people going there. The people who are economically disadvantaged. And thank you, and I honestly believe a loud applause for his vision. Please go ahead and please, let's clap for him, please. Another group of people I work with is elected officials. A number of elected officials here. I'm not going to take everybody's name. If you would please stand, let's be recognized here. Please stand. You know that I had to go back to them, so I just want to make sure I'm mindful of that. And as Fort Bend County continues to grow, become the 8th largest county in the state of Texas, many levels we are continue to thrive. And like the second fastest growing county, the second richest county, and the second best place to live, and one of the healthiest county in this region, and the most ethnically diverse, I already mentioned, etc. But let's not forget, we also have issues. And I was in the middle of COVID, and I saw that issues firsthand. Really, I did. And I worked very closely with OakBend and many community partners. And that is one of the reasons why I tell you, our office is spearheading with the help of Commissioner's Court. We will be taking a journey even better. And Fort Bend is going to be looking into, and we are going to be hiring a consultant soon to establish a hospital district in Fort Bend County, which is long needed. And I just wanted to say, we wanted to, and the hospital district doesn't mean we are going to be hiring and firing doctors and nurses and all that stuff. My vision is going to partner with OakBend, partner with Ibn Sina, partner with, we have Access Health and so many of them. So we can support what they're doing. That's my vision about it. And I hope I get everybody's support. And I know that Commissioner's Court is unanimously support of that discussion. And so we will continue that. I wanted to commend OakBend Medical Center's contribution to serving all our population, including the economically disadvantaged people. This is the reason why we are currently working to create, as I mentioned, a hospital district. Today, we gather here to celebrate a remarkable collaboration that epitomizes the spirit of innovation, education, healthcare, and advancement. It is with great honor and excitement that I congratulate all these partners you already met: Ibn Sina Foundation, Sam Houston State University College, Osteopathic Medicine, the establishment of Ibn Sina, as I mentioned, and also OakBend Medical Center. That's where we are here right now. This partnership marks a significant milestone, as already everybody mentioned, in our region, in the medical care of our especially economically disadvantaged people. Ibn Sina's legacy and Sam Houston State University's University College of Osteopathic Medicine commitment to fostering future healthcare leaders have seamlessly covered to create this extraordinary opportunity. Ibn Sina Clinical Training Region at OakBend Medical Center is undoubtedly served as the beacon of excellence, where aspiring medical professionals will receive unparalleled training and mentorship. By accessing the expertise of OakBend Medical Center, distinguished practitioners, alongside with innovative curriculum developed by Sam Houston State University College of Osteopathic Medicine, students will be equipped with the knowledge, the skill, compassion necessary to excel their careers and make meaningful contribution to this community. And by investing in education and development of future healthcare professionals, these partners are not only ensuring the continued delivery of exceptional care, but also addressing the growing healthcare need of our diverse population in Fort Bend County, as I already mentioned. Congratulations once again to Ibn Sina Foundation, Sam Houston State University Osteopathic Medicine. Sir, thank you for being welcome to Fort Bend County. Now you will be making more trips to Fort Bend County, I guess. And so, of course, OakBend Medical Center. This journey, Fort Bend County will stand in your journey. Fort Bend County will stand with you every step of the way. As Commissioner McCoy is here, others are here in spirit, and so we will be working with you closely to support this collaboration to succeed and make this center a sort of sought-after institution for students to excel in their medical professional journey. I'm sure this is another initiative to create our county a better place for our children and generations to come. Congratulations.
Thank you very much, Judge. It's a busy day for the judge because he gets to be in court all day, and we appreciate, Judge, you coming and being with us this morning. Life is a team sport. We don't get by very far in life if we don't look at it that way, and it's the ultimate team sport. Well, sometimes you have people that are on one team, and they can help connect you to another team. And I want to recognize Commissioner Dexter McCoy, who sits on the board of this hospital system, who also has been connected with Mr. Rapani and Ibn Sina. And so I want to invite the connector to come up and share some words with us this morning.
All right. Well, good morning, everybody. It is so good to see you bright and early. About 3 weeks ago, my wife gave birth to our second baby girl, and this is my first day back on the job. So this is an exciting thing to return to. I can't say how appreciative I am of Mr. Rupani for his vision, for bringing us all here today. You might think medical school, medical students in Houston, send them to the medical center, right? Well, no. We have someone in Chairman Rupani who had the vision to actually make sure that we had people being trained in the community that needed them most. Now, I'll say this is very personal to me because I was born in a public hospital just like OakBend. And if I think about my role as a board member here at this hospital and thinking about the deficit of resources plaguing hospitals all across the country, I couldn't be more thankful for Chairman Rapani, the Ibn Sina Foundation, and Sam Houston State University for coming to the table to help this school, this facility and this hospital system to be able to train the folks who will deliver world-class care to our residents. Now, on the other hand, as county commissioner representing this area, this is special because we sit in the area that has the highest poverty rate in Fort Bend County, right here in Richmond and Rosenberg, right up the street. And if this hospital didn't exist, where would those residents go for care? If these folks did not come to the table to ensure that there's a spotlight on this incredible hospital system, who would stand in the gap? And so that's why we're so incredibly thankful. I was so honored when Chairman Rapani asked me to be a part of the steering committee, and I, along with my team, helping to bridge the gap, to bring partners to the table to help solidify this partnership. But I'm really incredibly thankful for the partnership with the judge's office and the entire commissioner's court to help take this over the finish line to the next steps to ensuring that this is a lasting legacy, well-funded legacy here in our community. Now, I will also note this because this is critically important. What we're doing here today is about providing medical care to rural and suburban areas that often are left outside the bounds of care. If you can think about it, in some places of Fort Bend, it takes between 25 to 30 minutes to get to the nearest hospital. So what does that mean for those folks who are facing a cardiac arrest and where every second counts? What about for mothers who are going into active labor like my wife just did 3 weeks ago and need to get to a hospital to safely deliver their babies? This is our answer. So I'm incredibly thankful. I'm really excited for all that is going to lie ahead, and I'm really excited for this MOU that's going to get signed today. Thanks for your partnership.
Thank you, Commissioner McCoy. I think that we've had a lot to celebrate today. I heard about a health district from the judge. We've talked about residency programs. We've talked about students spending their third and fourth year right here. That's very exciting. Well, in our culture, sometimes we write things down and we sign things when we agree to things. So this is the moment we've been waiting for, and a good photo opportunity. I'm going to ask the three partners, and certainly Rhonda representing the hospital, or the chairman of the board representing the hospital. We'll have the chair come up, and Rhonda, both of you. We didn't get to introduce the chairman of the board of OakBend Medical Center. He's sitting right here. And also Rhonda, and we'll have all parties that are signing come up. There's only 4 chairs, but we'll gather around. So I want everybody to come up. This is kind of like where people put rings on the couple getting married. So everybody come on up here. So we have Mr. Jeff Haley, the chairman of the board. We have Rhonda Mayfield, chief nursing officer, Chairman Rapani, and behind him is his right-hand person, the person who runs Ibn Sina, Javed. And we also have Mike, and who's been introduced, and also Dr. Tom Moore and Dr. Mike Stevenson. These are the group that right now are signing a document that indicates that this partnership will stay strong and all of these dreams will come true. Thank you, everybody. Well, just like when there's a wedding, we always have to ask everybody there present to witness this occasion. And there's a role for everybody in this room, and that is to support this in any way you can. So people don't just get to leave and say it's these folks here that are responsible. Everybody here is responsible for the opportunity to work together and encourage with your gifts and with your talents and resources, this historic partnership. I didn't introduce myself before. My name is Paul Umbach, and I'm very happy to be the MC for today, and I wish you all a beautiful day in Fort Bend County. Thank you.